So the exam would start off by the doctor doing vitals, which would consist of blood pressure, pulse, temperature, pulse rate. He would also do a cranial nerve exam, which would consist of eyes, ears, nose, and throat, making sure there's no abnormalities of the cranial nerves. He would then start off by observing your posture in every plane, which would be from the front, the side, and from the back. He would observe you from during walking and when you're sitting doing range of motions. The doctor would note any discrepancies in pelvic, shoulder height, scars, any other abnormalities. The doctor would start to palpate your spine, and usually the doctor will start around your spine, which is called the paraspinals, palpating up and down your spine and along your hips. Then the doctor will palpate on your spine, and you might feel a little pressure, and at any time during the exam you feel discomfort, you would let the doctor know so he can stop and investigate that part. The doctor will have you do active range of motion, which means you'll be moving your head in all planes, flexion, extension, lateral bend, rotation. You'll have your low back will be examined in all planes. The doctor will have you bend forward, bend back, bend to the side, both sides, and rotate both sides, which would be active range of motion. The doctor may do measurements with a goniometer and see what the ranges are, so you have a pre for his post-examination. The doctor may take your spine and do a little bending with it called passive motion. More in the orthopedic neurologic exam is where we go into passive motions. The vascularity will be checked, meaning your pulses, your radial pulse, your femoral pulse will be compared for coarctation of the aorta. Pulse rate will be taken. Reflexes will be taken, all reflexes, pathological included, which would mean your bicep, upper body reflexes, tricep, the knee jerk, the knee reflex, and the Achilles reflex. So all of that, and pathological reflexes, checking for upper motor neuron lesions, lower motor neuron lesions. After that, your sensation will be checked with a pinwheel along the dermatomes of your arms. The doctor will run a pinwheel along your arm and certain parts of your arm to check the nerves that innervate that part. The doctor will do a pinwheel on your leg to check the dermatomes of your leg, also to check the nerves that control that part of your leg. The doctor will check your muscle strength in your upper body, so your biceps, your triceps, your deltoids. The doctor will check your muscle strength in your lower limbs, your legs, your hip flexors, your hip extensions. Then he'll do specific orthopedic neurologic exams, basically taking your leg and lifting your leg up in the air and noting if there's a discomfort in your lower back or radiation to your foot. Maybe having you bend your head and applying a light pressure on your neck to see if there's any discomfort and that it might radiate down your arm. These are called orthopedic neurologic tests. The doctor would then continue after that. After the orthopedic neurologic test, he would determine what special images you would need. For example, digital x-rays, MRI, or CT. After that, the doctor will wash his hands and thank you for letting him examine you and give you a diagnosis, a prognosis, and a treatment plan, which may consist of chiropractic adjustments, traction, soft tissue mobilization, myofascial release. It depends on what the diagnosis is. You will be giving specific exercises and stretches to do at home to go along with the treatment plan.